Good day. I'm Robert Bell, professor in the Department of Communication. I also have an appointment in public health. In addition, I'm a member of the Center for Healthcare Policy and Research. Today, I have the privilege of introducing you to my area of specialization, health communication. Let us begin to answer the question, what is health communication, by considering a few examples of health communication. Many parents resist vaccination of their children out of false concerns about the safety of vaccines. As a result, a state health department might launch a media campaign to encourage parents to vaccinate their children. This is an example of health communication. Another example of health communication would be the use of billboards on freeways to remind drivers to use seatbelts. Such a campaign has the advantage of delivering a message at the time of decision. Health communication is also found in healthcare settings. The doctor who tries to convince his diabetic patient to lose weight would be an example. Health communication can be found in more informal settings as well. For example, a person is engaged in health communication when she talks to her roommate, someone who likes to party hard, about the real risks of alcohol poisoning. Sometimes the target of health communication efforts is not the person directly affected by the behavior in question. An example would be efforts to teach parents how to help their children to eat healthy foods. Parents are health communicators when they talk to their children about sex and other matters that affect a kid's health and well-being. A recent public health campaign that told young men that their smoking habit could affect their ability to perform sexually is our final example of health communication. Hopefully, these examples make you aware of the fact that health communication is found in both formal and informal settings and can be initiated by health professionals and laypersons. Let us turn our attention to definition. The Centers for Disease Control and Prevention, the CDC, and the National Cancer Institute offer a definition of health communication that is widely cited. These organizations define health communication as the study and use of communication strategies to inform and influence individual decisions that enhance health. If anything, this definition is a bit too restrictive for me because it implies that health communication is always targeted at individual people and their individual decisions. In fact, health communicators use strategies to alter society and especially its social norms. An example would be efforts to define texting while driving as irresponsible behavior. Health communicators might even try to change policy by influencing government decision-making bodies. That said, this definition serves our purposes for now. Health communication is by definition about health, but what do we mean when we use the word health? The World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. You are healthy if you feel good physically, feel good mentally, and have the social support and other social resources you need to thrive. Our definition of health recognizes the importance of both physical and mental health. What is mental health? The World Health Organization defines it as a state of well-being in which every individual realizes his or her own potential, can cope with normal stresses of life, can work productively and fruitfully, and is able to make contributions to her or his community. People in health communication do indeed look at how communication can advance mental health. For example, I've been fortunate to work with physician researchers on campaigns that educate patients about the symptoms of depression. That's health communication. Our CDC definition of health communication tells us that health communication includes both its study and its use. We've already looked at examples of the practice of health communication. Let us spend a few moments talking about its study. One thing that might surprise you is that health communication is truly an interdisciplinary study. It is not owned by the communication discipline. You will find health communicators who claim affiliation with many different disciplines. These include medicine, sociology, public health, psychology, journalism, public relations, and other fields such as economics and anthropology. Another important point to be made about the study of health communication is that it is an applied social science. Health communicators are primarily concerned with understanding and solving problems in the real world. Ideally, we are investigating these real-world problems by developing and testing theories, that is, formal explanatory frameworks that can account for these problems. We try to solve these problems by applying those same theories. Sometimes those applications highlight problems in our theories. We then refine those theories to enable better problem solving in the future. By giving you examples of health communication at the outset, you probably have already figured out that health communication takes place in many different kinds of settings. Let us review these to ensure clarity. Health communication is studied and used in our healthcare system. For example, most of my career has been devoted to studying communication between doctors and patients. Some researchers look at how new technologies can be used to improve doctor-patient communication. Others look at interprofessional communication among the team of healthcare providers that take care of patients. Much of what takes place in public health involves communicating with the public to keep people healthy. Traditionally, such communication has taken the form of media campaigns. Health communication does not necessarily involve a medical or public health professional. We all engage in communication about health every day with our friends, family, and sometimes complete strangers. Your parents may have talked to you about safe sex, smoking, bike helmets, and many other things when you were a teen. That is health communication. You may have talked to your friend about the dangers of his addiction to unhealthy fast food. That's health communication. A friend might scold you when you do not get the HPV vaccination. That is health communication. Much research has sought to understand health communication aimed at getting you to buy a product or service. You will find advertisements in the media promoting prescription drugs and medical services. The Cancer Centers of America seek to convince you that they are the place to go for oncology care. Kaiser tells you that it can help you to thrive. These advertisements are not inherently good or bad. It depends on the message and people's response to the message. Earlier, we defined health communication as the study and use of communication strategies to advance health. However, if we want to understand how to communicate strategically about health, we must understand the environmental influences that shape people's responses to those strategies. We will end this video by talking about 4 sets of environmental influences, beginning with the media environment. We live in a sea of media: television, film, the internet, video games, newspapers, magazines, and so forth. The media are often used by health communication professionals to deliver strategic messages about health, as we have already seen. But here we are concerned with the many messages in the media that could facilitate or interfere with the efforts of health communicators. Suppose you wanted to launch a campaign to convince teenagers to moderate their consumption of sugary beverages. There are a lot of messages in the teens' media environment that will make your task more difficult. They will see advertisements from Coca-Cola, Pepsi, Mountain Dew, Dr. Pepper, and other companies. They will see cool celebrities drinking sodas on TV and in the movies. The producers of these movies and TV programs might have even been paid to place the product on the screen. As a health communicator, you would need to know about these competing messages. People's responses to health messages can also be shaped by other people they know. A friend might reinforce the good news that you've already heard about plant-based diets and health. That's a good thing. However, all of your friends might be addicted to Big Macs and Whoppers. Their decision about where to eat could become your decision, whether you want that or not. The physical environment refers to the physical aspects of the communities in which we live. Some communities facilitate healthy decisions, others do not. A campaign to convince you to eat more fruits and vegetables might be effective for people in this college community. We have farmers markets, a co-op, and other great places to buy fresh fruits and vegetables. However, there are communities that do not have such amenities. There are neighborhoods where people have to buy food at convenience stores or at fast food establishments because there is no grocery store or farmers market, no co-op. These neighborhoods have been called food deserts. Our hypothetical campaign will fail in these unhealthy physical environments because persuasion is not enough. The final environmental influence we'll talk about is policy. Consider once again childhood obesity. Some students attend schools where the school board has banned vending machines that sell unhealthy foods and beverages. That is a health-supporting policy. Other kids go to schools that have contracts that allow vendors to bring these items into the schools. That's a health-defeating policy. Some citizens live in states that protect non-smokers from smokers' exhaust. That's a health-promoting policy. Citizens in other states are not protected. To conclude, health communicators are concerned with using communication strategies to promote health. The proper use of strategies often requires that we understand the media, social, physical, and policy environments in which communication activities take place.